Hello, my hospice family. Come on in. Come on in. Come on in. We are live. We are live. Yes, y'all. I'm drinking some coconut water. It's very good for you. It's like one of the best waters out there. Coconut water. Get yourself some. It's good for hydration. Okay. For those of us with loved ones who don't like to drink and we are trying to keep them well hydrated during the day, um definitely coconut water is the best because it also have nutrients, um all of the good things that our body desires and needs in order to perform at its best. Okay. So yes, my hospice family, come on in, come on in, come on in. You guys are awesome. Absolutely awesome. Happy holidays. Happy holidays, my hospice family. Um, Christmas is right around the corner. Okay, as you know. Um, we just basically have 2 more weeks, just 2 more weeks until Christmas, and I pray that Santa Claus is going to be good to us. um, you know, and I know it's a bittersweet moment, especially for us caregivers, caretakers. But I want you to know that I want us to know that we are here. We have a community, okay, at Duns Hospice. I am thinking about you. I am praying for you, my subscribers, my followers, the patients that I encounter during my daily activities, the families. Definitely thinking about you guys and praying for you, okay? Um, yes. Come on in, come on in. Um, Here at Dunn's Beautiful People, we talk about end of life care and about hospice care, okay? And once again, I'm going to talk about, my book that I wrote. Hi, my hospice family. Good afternoon, everybody. Please say hi as you come in. Hi, Rs, Gigi. Hi, how's everybody doing today? Yay! I'm glad. I'm happy to see you guys. It's such a pleasure whenever I see my hospice family. Tell me where you're from. And please subscribe and like the video as you come in. Okay, we're going to continue to talk about hospice and end of life. I am a hospice nurse. My name is Nurse Dunstedler. I take care of people at end of life. You see, when somebody is dying, when somebody is at end of life. Thank you, whoever subscribed. Yes, nice to meet you. I am here in the USA. I'm here in the USA. You guys, please give me a like and subscribe as you come in. Let me know if you are a caregiver. Let me know if you have experience taking care of somebody who's dying. Let me know if you have experience taking care of somebody at end of life. You see, when the doctor, hi Cookie 3 Loving. Thank you so much for having subscribed. Thank you for welcome to the family. Yes, my husband's family. Let me know who among you watching right now, who among you have had to take care of somebody at end of life, have had to take care of an elderly family, of an elderly parent. And let me know your challenges. You see, let me see, let me see your challenges. Let me know what are some of the things, that um you would like for me as a hospice nurse since 2012, you would like for me to, talk to you about, to deal with you, to help you, to guide, so let me know. But I wanted to come out here briefly and just talk about, just continue to talk about my book. I'm so excited, guys. I'm so excited So happy. I actually wrote this book. Okay. Um, and I'm just so honored. God is so good. God is definitely, you know, so good to me. Okay, so R says, what is the most popular thing that you do in your job? Oh, popular. I'm not sure if I would say popular, but I would definitely say the most rewarding. Okay, rewarding would be the word that I would use, if that's okay. The most rewarding part of my job is that I get to walk into somebody's home, and then I get to make them pain free. I get to make them comfortable. You see, so that they're not suffering, so that they're not having any pain. You see, so I walk in there when the patient is in agony, is probably screaming out because of pain. Imagine you have somebody, with like bone cancer. Okay, so with bone cancer, so the cancer is, all over their body, it's really painful. Or you have somebody with lung cancer, okay, where they're having problems to breathe. And so I, as a nurse, I get to walk in there, and I get to educate the family. I get to administer medications, okay? And all of these skills, all of these techniques help the patient to feel better. So at the end of my visit, the family is usually saying, "Oh, I'm so glad, nurse, that you came. I'm so glad that you came and that you taught me the proper dose to administer to my family." And oftentimes, especially when it comes to medications like morphine, the family is very nervous at giving the first dose. You see, they're nervous at giving the first dose of morphine, and they're also nervous at increasing the dose. So myself as a nurse, I get to come in, I reassure them, I walk them through the whole process. You see, I teach them how to draw up the medication. I administer oxygen. You see, um, we have a lot of people who needs to be on oxygen because of they cannot breathe, they have COPD, they have lung cancer, things like that. So, and oftentimes the family, they don't know what to do regarding administer medications like oxygen. They don't know how much to put it up to. So I get to walk in there and really teach them and kind of walk with them, okay, and hold their hands and reassurance. Because a lot of times my hospice family, the family, they need to be reassured. Okay, they need to be reassured that everything will be okay. All right. And so myself as a professional, okay, I've been a hospice nurse since 2012. You see, and so I get to, this might be your first time. Think about it. This is your first time your mom is dying. This is the first time you have a dad who's dying. You have a mom who's dying. You have a spouse who is dying. But me as a hospice nurse, this is what I do every single day. You see? And so therefore I get to walk into the home and I get to reassure you. I get to teach you and kind of walk you through doing the medications, doing the treatments, okay? And so that is definitely rewarding to me. I hope that answered your question, Ars. Okay, and you also wanted to know, yeah, okay, so I touch upon that, okay? If somebody is having difficulty breathing, there are two things we usually do. First of all, we usually give you oxygen, okay? We give you oxygen at home. Usually, when you're under hospice, we will order you the concentrators, okay? It's called an oxygen concentrator. It is loud, but it's good, okay? You get continuous flow 24 hours. So we will administer oxygen. Also, most likely we will give you morphine, okay? Because morphine, it does two things. It helps you with pain, and it also helps you to open up your lungs, okay? Okay. Not No, I'm not like an ambulance. I work for agencies. Yeah, I work for agency. But I am a nurse coach. Okay, that's my passion. I am a nurse coach. I'm a nurse educator, and like I said, I wrote this book ours, go ahead onto my website, dunsbeautifulpeople.com. Okay, it's in the description bar, and get yourself, okay, one. If you are looking for a Christmas gift that you'd like to give to me, all right, get yourself one, or that you'd like to give to, any caregivers, who's taking care of somebody who's dying under hospice care. This book is very, very informative. It's very, very good. Okay. And it's short and simple. Um, it's only 24 pages. Okay, it's only about 24 pages. So it's short to read, very good to read. Guys, give me a like as you come in. Please give me a like and subscribe if you haven't done so. But I wanted, in my last video, my hospice family, and please let me know if you have any questions. And thank you so much, RCG. Thank you so much for asking me these questions, okay? But I want to continue in the last video. I spoke about Mrs. Doll and Mr. Pete's, okay? Um, so let's see. You wrote, so you coach people, wants to be a nurse. I coach people. That's a good question. Thank you for asking. I teach people, I teach caregivers. Okay, I coach caregivers of how to keep their family comfortable at end of life. You see, that's my specialty. I teach people, all right? I teach people how to keep their family comfortable at end of life, because oftentimes we don't know what to do when somebody is dying. Okay, when the doctors say that, you guys, I'm sorry, I think my internet went off. Are you guys back? I Can you guys hear me? My hospice family, can you guys hear me? My computer, my internet went out. Can you hear me? Let me know. So I teach people, I teach families, I teach caregivers um the skills that they need, the knowledge. I empower you of how to take care of your family members when they're dying. Okay? So for example, if you have, kidney disease, if you are on dialysis and you decide to stop dialysis, you decide to stop all of the treatments, and then you want to be at home and die comfortably. I teach you, how to keep your family comfortable in the home, okay, with some techniques. All right, that's my specialty. All right, as the hospice nurse coach. All right, and once again, I have my website. Please check out my website, guys. Dunsbeautifulpeople.com. Okay, dunsbeautifulpeople.com or DunsLove.com. Okay. All right. So I wanted to just finish up the chapter that I want to talk about. Okay. In the last video, and if you haven't seen it, please check it out. Okay, check out the last video. One second, guys. Okay, check out the last video that I made about the book. And so once again, I want us to know that hospice care, it's individualized. Okay, we definitely um make everything individualized, because it's not just about one thing works for everybody. You see, somebody can have the same illness, like three people can have the same illness. All right. Three people can have liver disease, for example, and all three of them have different family needs. Family dynamics is different, their needs are different. You see, so we in hospice care, is for the individual. We see you as an individual. Like, we don't try to come into your home and treat you like everybody else. No, everything is very individualized. Okay. You say my aunt has a problem with her because she was born with the catches seizure and catches them a lot. Oh, I'm sorry to hear that. Make sure she takes her medications, okay? Make sure that your aunt stays on top of her medications, okay? The medication that the doctor prescribes, especially things like Keppra is, things like that. I mean, I'm not her doctor, so I cannot say, but just make sure that she takes, she keeps up with her medications. Hi, kid. Hi, Kitty F5305. Hi, Kitty. How you doing? Thank you for being here, everybody. Good. I'm glad she does. I'm glad she does. It's always good to follow doctor's orders. All right? Absolutely. Um, yes. And also, guys, I want us to know, okay, that hospice does not hasten the dying process. You see, hospice does not mean that you're going to die today. That is a misconception too many times. Too many times, guys, people feel that, oh, if I put my loved ones under hospice this morning, they're going to die tonight. You see, and that is not true at all. I'm from Massachusetts. Okay, I'm from Massachusetts. Close enough to New York, but not quite. Close enough. Yes, guys. Too often people feel that, you know, oh, if I put my mom under hospice this morning, she's gonna die tonight. And that's not the case because okay, research has shown that people actually live longer under hospice. Yes, they do. And the reason you may want to know is because of all of the added support that you get when you are under hospice care. For example, okay, you will get a nurse, all right? You could call at 2 a.m. and a nurse can be at your door. You see, you will get your medications easily, easy access to medications. Okay. So those are, I mean, and the list goes on and on. I have other videos that I wrote. I mean, I have other videos that I made about this topic, about, the benefits of hospice. Please go back and check out my videos, okay, guys? Please, please, please check them out. But I gotta get going. But before I go, I just want to read to you guys, you know, just one chapter real quick, just chapter 3, okay, of my book, all right, my husband's book. I'm so, so proud of myself, guys. And once again, please get yourself a copy, okay? Get yourself a copy. Okay, give it to somebody for as a Christmas gift, give it to yourself, you see, all that good stuff. All right. Um, so chapter 3, why hospice now rather than later, okay? Why hospice now rather than later? As shared in the previous chapter, as shared in the previous chapter, hospice provides several great benefits to both patient and caregiver. Unfortunately, in most cases, I see that families will wait until the very end when the person is on their deathbed before they call hospice. Sadly, by then, the individual is unable to the individual is unable to reap all of the benefits explained earlier, and much more that hospice care has to offer. The best practice is to contact hospice at the beginning rather than at the end. For instance, if you or a family member are in similar situations as Mr. Peace, it would greatly benefit him or her to contact hospice soon after having been told by the doctor that there's no treatment available for your diagnosis. The hospice team now has time to plan and design an individualized plan of care in order for you to achieve maximum quality of life. Okay. The best plan of care can be achieved when collaboration exists between the patient, the family, the caregiver, and the hospice team. The family and the teamwork form an alliance to communicate and interact in such a way that will optimally provide the best care for the patients. As in the case of Mrs. Dahl, her pressure ulcer would most likely not worsen if her family willing to place her under hospice care sooner. This is because she would have weekly wound care, nursing visits, which can be 2 to 5 times a week. Isn't that amazing? Having a nurse come to see you, come by to see you at least 2 to 5 times a week. That's awesome. Okay. Her falls might be minimized due to the added safety, teaching, and equipment that the hospice nurse can provide. Another great service might be managing her medications. Hospice care can provide medications that will decrease the level of agitation and anxiety that Mrs. Dahl is manifesting. Hospice nurses can deliver Hospice nurses can medicate and also properly teach the family how to facilitate medications for their loved ones. Okay? And to keep them comfortable and to avoid going to the hospital. Moreover, in managing her UTI, a hospice nurse can obtain a urine sample from mom in the comfort of her home. Afterwards, the hospice nurse will bring the urine sample to the local lab. Once the result is obtained, nurse collaboration with the hospice doctor and will fax over a script for the best antibiotics to the local pharmacy and have it be delivered straight to your door. This is a great service allowing patients to avoid having to make an unnecessary trip to the hospital. Okay? So yes, please grab it, grab it. So yes, my husband's family, I have to go now. It was awesome to be here today with you to talk about end of life care, to talk about hospice. Okay, let me know if you have any questions next time when I come in. If you have not done so, please subscribe, and give me a like, okay? Hit the notification bell, hit the notification bell so that you'll know each time I upload the video. Have a wonderful day. Okay, guys? I love you with the love of Jesus Christ. Take care of yourself, take care of each other because tomorrow is not guaranteed, okay? We don't know what tomorrow holds. Tomorrow is not guaranteed, all right? Take care.